Fibroids are a common problem in women's health. Fibroids are a tumor that grow inside the uterine wall. And tumors can be benign, which means non-cancerous, or malignant, which is associated with cancer. Luckily, fibroids are of the benign or non-cancerous type. When these masses grow inside the uterus, they can be as tiny as a pea or as large as a grapefruit. Patients can have a variety of symptoms when they have fibroids. Some fibroids are totally asymptomatic, and the patient may not even know she has them unless her doctor does an exam and can find them. Other times, patients can have irregular bleeding, heavy menstrual cycles, or painful menstrual cycles. And sometimes it's these symptoms that will bring you to the office to start a search for fibroids. Fibroids are also very common in families. So if you have a mom, a sister, or an aunt who's needed some treatment for fibroids, you may be at higher risk for developing fibroids. Fibroids can be diagnosed with a pelvic exam, and sometimes we also use an ultrasound. Depending on what your symptoms are will help us to determine how to treat your fibroids. If the main symptom is bleeding, very often we can use some medications like birth control pills or other hormone pills to help control the heavy bleeding that fibroids cause. Other times we can do some minimally invasive procedures to treat the fibroids. One treatment that we use is a hysteroscopic myomectomy. This is an outpatient procedure where the doctor puts a camera into the uterus and cuts out the fibroid, but you're left with no scars on your abdomen during this procedure. Another procedure is a laparoscopic myomectomy. During this procedure, the doctor puts a small camera in through your belly button and inflates your belly with some gas. We can then do a surgery to remove the fibroids from the uterus and sew up the uterus. Most patients who have their fibroids removed have excellent control of their bleeding and pain. However, you should talk to your doctor if you want future fertility after fibroid surgery.